Oh, Daddy, I record you.
You see my 7th grade way of flirting.
So
Let me ask you,
This right here.
all right.
No.
All right.
Gonna be high. She showed you over text?
No. You said it's gonna be high?
Maybe a little high.
Have they told you that
Me?
it's high?
Yes. A little high. Awkward.
They didn't tell you like your doctor. I thought you was done.
Tell me.
did you get some of the beet juice?
Yeah, if you still got the text on that.
It's all gone.
Like, no, it's not all gone.
I got the cucumber juice.
Oh, okay.
I'm gonna try some beet juice.
If you're talking about this, the rest that's in the kitchen, we could add a little water to it if it's like thick, because it's Tony, you gonna be taking blood pressure? Yes, you are, ma'am.
What's wrong about a cellar?
Take your medication.
So Nikayla can talk and you can take blood pressure. You don't know how to use that one? Oh, you use something else? Oh, okay. So Daddy, what did she say?
She said 150 over 80.
And what does that mean? Do you know?
It's a little bit high.
It's a little bit on the high end.
The minimum should be like 140 over 80 or something like that. I don't know.
No, what is?
I'm gonna educate you guys.
You know what? I need to go back to that because
To 120.
To 120 is the goal.
120 is the goal.
Yeah, 120.
120 over 80 or 120 over.
You said it's the goal.
Right, or to get it lower, because he said it's 150.
So what is it? I know there's two numbers. So
Yeah, there's a systolic and a diastolic number.
Okay.
So the systolic is the first one, and yours is 150.
Okay, I'll give it back to you.
you can do it. You want to do my? You can be my.
Oh,
I
I can record.
I used to know some of that stuff. I don't.
It's so crazy. So I actually took a class to get into the a test to get into the medical field. They actually have a program, I think it was through Tufts, where if you don't take a conventional, like go to school, get a medical degree, you can take their program and they'll get you into it. I guess I tested that because they didn't call me back to be a part of the program, but think about it, I was just like, okay, I think this is what I want to do or whatever. So I took that, like, not getting into the class. I was like, this is not my field. let me stay in the environmental field. I was like, okay.
What was yours, Diane?
And Tony, I think I even told you about the program. I sent it to you or something. It was a long time ago. It was a long time ago.
Diane, what was yours?
130 over 80? Nikayla is 130. That's good or bad?
That's slightly elevated, like slightly elevated.
Okay.
It's supposed to be anywhere between 100.
Oh, okay. So it's between 100 and 120 is what she said. So if it's anything above, then it's high.
But sometimes you have to do it twice, because the first one.
It depends on what you were doing before you
Your
got
blood
your
pressure is
blood
going to fluctuate throughout the day. And yours is like 125.
Oh, we
pressure.
asked him where he
Mine
put in his
is
chili.
on the high
Higher
side.
level. Yeah.
It's been that way for a while.
What you put in that chili?
Is everybody here?
You got it.
150 is.
125 over 70.
Everybody here?
Okay.
I'm second. Outside. Very high. From all the sabotage.
Yours is worse than mine.
Where was I?
Let me know when y'all ready to start. What happened to this
You said gentle. She's not being rough.
You could have said that. They're taking blood pressure.
Mine is normal. 120, I got 125 basically. But then if it reads up to 130 to 139, stage 2 high.
Yeah,
Mm-hmm.
you're right.
Oh, so you only have stage 2 high blood pressure. Mine is like 5%. It's like 5%.
Auntie May's at 120. 120 over.
Yeah, it's all
I'm feeling hot right now. 120 over 70.
Get
some judges.
Actually, don't. I don't know why.
Take like 120 over. Take advantage of the elderly.
Okay, Auntie May.
Auntie May has a best blood pressure that I've checked so far. Alright, girl.
Because I can tell that, like I can tell that it's running like. I can see, like,
I didn't skip you, Shahari, on purpose. Definitely.
He put paprika in his chili. That's all he made his chili with. Nah, Larry asked him for 3 main ingredients. He said paprika. And that was it.
I know, Jahari, you really could have said ground beef.
I said, what did I say?
Anything.
His chili was just consistent.
Auntie May, do you remember what your blood pressure?
120 over 70 or something.
Yeah.
She didn't do him yet. 126 over. I'm not making. Why you asking paprika? I ain't making it up. That's what it said when I went to
Okay, that's good. I think she said 130 over 80, so it's pretty good. It's not too
And
bad.
obviously, blood pressures will fluctuate based on, you know, what you eat.
Hers should be nice. It probably was that stewed chicken.
It was that turkey base.
Hers was all fresh ingredients. Celery, everything.
Yeah, I had celery.
Oh yeah, she do drink all of the
You
yeah.
have beet juice too?
Mhm.
Oh, that's what I should have been drinking.
What you talking about? You just said your stewed chicken was with celery.
I didn't even eat it.
You didn't have no celery? I mean, sorry, your stew chicken? You didn't have any of it?
I got too bold.
Yeah.
He was tearing it up.
Yeah. He's like, y'all need to shut up now, because my blood pressure about to go up. Trying to get some sleep on me.
Did she read in the numbers? Now you know.
What are you talking about? What you want me to do?
No.
You want me
Put
to
a
check
little
it
bit of
again?
extra salt.
I didn't put no salt. Do the other one.
She said do the other arm. Where Tony at? You want your daughter
But
to
she
take it.
also leaning on my.
She's still excited from her unexpectedly winning.
So silly. You had a drink, didn't you? Well, I've been eating everybody else's food. I don't know how.
You should have been eating the vegetarian lasagna.
Y'all blaming on everybody else.
That would have did you right. Mhm.
No, that means she ain't have that celery and stuff she claimed on.
No,
I know. Speaking of, I want to make sure there's some left. I'm gonna give this back to you. I just want to grab some lasagna real quick before it potentially
disappears.
What
Alright.
was the Auntie Geneva, what's the
Yeah, why is she talking about I ain't better one
the same?
one? So yeah.
And
And then now she blaming it on everybody's food.
No, for real. Because if you don't eat,
Oh, you got it?
Mhm.
Oh, okay.
start eating all different kind of foods that will raise it up.
And also play some Matilda.
That's true, yeah. Certain foods make your blood pressure high.
Well, how come ain't nobody else is like that?
Because they had that stewed chicken.
I didn't eat no stew.
Could be your salt intake too.
Right.
I know.
But then too, if did that beet juice, I bet you.
If you would have ate paprika, then you would have been all right.
Hey, Leisha. I haven't seen you. Yeah, 'cause mine.
They done elevated my blood pressure because they didn't eat enough vegetables.
Eating the vegetables?
No, they didn't eat enough
have vegetables.
Is everybody here so I can do a quick presentation?
Yeah.
Sure.
Yes, you sure can.
Who we waiting on?
Uncle Larry's
Who's
outside.
waiting on
His
me?
blood pressure's up. He needs to come in and get his blood pressure done.
What is that?
Rockstar, go to Uncle Larry.
I can't remember everybody. I said 140 over
He don't
70.
want to go out there because he got to add some more ingredients.
Mine's is 150 over 80.
Oh, LJ.
Go tell Uncle.
150 over 80 is good.
It's a little high,
Daddy, you
but
said yours was
No.
150?
yeah, it was one. Yeah, it's a little high though. It's,
Not
it's,
too high. You probably need to sit down.
you
You're
know,
moving
He was
around.
sitting down.
He
Yeah.
was?
110 over 70.
I gotta start
Oh, you got the
exercising.
best one in the house.
No, May got the best one.
What was May?
May's is like 120 over 80. Was it?
What? Hers was good.
Geneva, you heard that?
My brother?
110 over 70. Not have
No.
juice.
She didn't
She's talking about
She
she's
tried to
Larry.
blame everybody else's food. Wait, before.
Maybe Larry.
But I have some of everybody else's cooking.
No, yeah. But no.
I'm excited because I didn't know.
No, before she was saying, yeah, I drunk my celery and everything. I'm saying, she's about, everybody else is cooking.
Check the other off.
Yeah, that's true.
Oh, no.
Yes.
Geneva? Quick one up.
You gotta get your blood pressure
I gotta
checked.
sit down and relax. I gotta start eating so my blood pressure. I gotta think about seeing the island.
Maybe come here.
All right, everybody ready?
Do Uncle Larry.
You didn't do
Yeah.
Well, I'll do
Oh,
his.
it's right there.
I'll do his after.
You didn't want to. Okay.
I'm watching this.
I was supposed to relax. Hey, now. Not me. I me and man. They're trying to play games with
Get your blood
me.
pressure done.
Yeah, I ate everything. I ate
You
everything.
did. You so
Eat everything.
Take your blood pressure. Yeah, no, you have to do a presentation that you need to say.
It's a must-see presentation.
Larry got the highest blood pressure. So he was hot. His is through the roof. I know his is through the roof. He needs to get his taken.
Here comes Levon.
Okay, and I don't expect anything else. Okay.
See juice, alright?
You want me to add a little water to it?
Listen, our thing stopped working. It stopped working for a little while.
That's good.
It's good? Sure? I can dilute it.
No, that's good. The juice is good for you.
It is good for you. Did y'all read the thing for how it's good for you though?
The cucumber juice.
The B one is out there too.
Oh, it is?
Yeah.
I gotta read that.
So it helps with lowering and regulating your blood pressure. Nishayla, can you get the sign for the beet juice one too? Well, get both of them, yeah, to pass over. What are you doing? Trying to calm your nerves?
But Geneva over there bad too because everybody else is cooking. No, but before she did it, I ate my
Baby Tony, it's not candy.
No, I thought it was
Okay,
Everybody's made
No
of
way.
hers too.
I'm gonna check it again.
First I thought it was like food that they cut chopped up, but it's like there's a needle.
Soda.
Okay. Oh, the little. Do you want me to?
And Tulisha, yours is perfect. 120 over 80.
Because I keep it that way.
Yes.
So you and May got the perfect one.
Alright, everybody. Everybody get nice and comfortable. I'm gonna do a slight presentation, okay? I will do his. I just want to get started because I know everybody's been waiting. Okay?
Oh, I'm good.
Hello, everybody. Hello. Can I just get your attention, please? My name is Nikayla. I am your family.
Get out of here.
I am your family paramedic. Okay? Everybody knows I'm a firefighter in the family, but I'm also a paramedic, and it just occurred to me that there's things that is very that I'm aware of that everybody in the family isn't aware of, and I just wanted to make sure you guys were educated properly.
There's something to add on to
Okay?
that.
No, after.
I just wanted to educate you guys properly on some, some medical and health conditions that you guys should be aware of, and then also medical emergencies that I go to, and I just wanted to make sure you guys had the life-saving skills that, be able to help with any medical emergency, okay?
Or call her.
So for starters, I thought that the best place to start would be with hereditary medical conditions that run within the family, right? So I don't know if everybody is aware of, where are the kids? They need to be aware of this. Can y'all come down here, please?
You did get put down here right now. LJ from me, I know y'all put my black and miles in that toilet.
Yeah, right.
That's him with that.
Uncle Larry, I'll check your
Crushing up his cigarette.
Damn it. Get it here, boy.
Legs on both ways.
You can relax, y'all.
And remember, he slapped you and you slapped him back.
Wait till you get older.
And he was so shocked he didn't know what to
Say, buddy.
Oh, look who's back.
So y'all done moving?
You didn't touch that bag.
You don't have to bring the bag down. No one's gonna take it from you. I'm gonna bring this back upstairs, Orion. No one's gonna take your bag.
Yeah, she was shopping.
We have some clothes for them.
Yeah, she wasn't
She
playing.
came running like she was
Oh,
stealing.
what?
All right. Is everybody here?
What was 140 over
His
what?
140 over 80. From Valari.
You almost expected that.
So we jumping ahead.
Yours was worse.
We jumping ahead. I'm so glad that the kids were able to join us because this is also going to be important information for them as well. It's not only for the older people, but this is for everybody. Like I said, we're going to be discussing medical conditions and health risk factors that we're all exposed to because there's a lot of stuff that's genetically passed down in the family, as well as things that you expose yourself with the risk factors that you decide to engage in, and those are things that we'll discuss today. So first, I want to talk about the family medical history that we have. Does anybody know about the medical histories that run in the family?
High blood pressure, sugar
High blood
diabetes.
pressure, sugar diabetes, cancer is another one.
Delusional.
Stop it. and specifically with the cancers, it's going to be throat cancer, pancreatic cancer, small intestine cancer, and then on daddy's side of the family, I think Nana had ovarian cancer. So these are going to be things that is important for you to know so you could discuss with your primary care doctor because early detection is going to be the best fighting chance for those things because like I said, genetically, like we are exposed to certain medical conditions that it just falls out of our control. So like early detection is going to be the best fighting chance as well as early intervention, okay? So then there's, I think there's two other things. So we said high blood pressure, we said diabetes, we said cancer, and then we listed the cancers. What else we have?
ADHD.
Oh, you ask, if you meet someone, you ask what kind of stuff they have.
I'm saying in the family,
And a sickle cell trait.
Do we have sickle cell?
Yes, that's why you asked. Why you?
All right, well let's talk about it. This is important space.
Mental health in the family.
Mental health is also something that runs on both sides of the family. But these are going to be important things. I know you're supposed to be sharing. So what are you doing?
Is this for you only?
No.
She's the one more.
It's not.
She had hers already.
She's over here.
I'm sorry. I'm just.
Okay. So So we have high blood pressure, we have cancers, and we listed the cancers, right? And then we also have diabetes, and then mental health issue. We also know that runs on family. And then what was the other thing? Sickle cell trait. And then I also have listed. Well, it's important for you to know your mom has carpal tunnel. Well, cholesterol. So okay, cholesterol. High cholesterol. So like I said, these are going to be very important for us to know so that we can make our primary care doctor aware of it. So these are things that we can have, have them test for, and then basically keep an eye out for. Right? Like I said.
And we need to get the age.
Okay, and then also Grandma had mentioned to me CHF. CHF also, which is a heart kind of it's a complication within the heart. That's going to be something else that also runs within the family. It's like a type of heart failure.
Wait,
and so
digestive heart.
What age were a lot of these what are they called? Health concerns brought up with like people in the family.
Which one are you talking about?
With
all
the
of them.
conditions when they were detected.
Really
Yeah.
discovered with mine was in late 20s.
Okay. That's really
No,
early.
she never told anybody. And then what about
I
that
You didn't have to
cancer
say that.
thing? What was that?
That was in 40s. Yeah.
And you beat it. What was it though?
That's why I said throat, pancreatic, small intestine.
Okay.
Those are the cancers, just so that you're aware of, so that when you do go in for checkups, you do monitor you should be in tune with your
But
body.
also, Auntie Cicely have breast cancer too. So
Yeah, I've heard breast cancer also running in the family.
And
But like I
was gonna say
said,
for Black
whenever your
women,
doctor
that's another
asks
one.
us, like if there's any family medical conditions or like any anything that your family.
I'm calling that as I want it. I ain't got none of that myself.
Well, you'll be doing yourself a disservice.
They beat it.
Like I said, no, it's not about that.
It's not a laughing matter.
You have to monitor
You ain't
things.
honest with nobody else, honest with your PCP, okay?
Mm-hmm.
So
So
that test that they run to check.
exactly.
They got
And being in
Cologuard if you're
denial
afraid
is
of
not gonna
colon
help you.
cancer. Do
Oh,
the
also speaking
Cologuard.
of colon cancer, when you're 50, you should definitely get your colonoscopy.
My sister's
That's
colon is
definitely-
clear. She was just swinging on
Yeah.
the thing. Anyway, it's gone.
Colonoscopies or
So-
Cologuard. That's the new thing now. They don't really have to go up in you with the scope. You can.
Ain't that only for men?
And for men, they gotta
Men
go
and
on
women.
state.
Oh,
It's for
No,
both.
for men,
Yes,
for men,
both.
y'all should get your prostate.
Man,
But
you
I'm
even-
digressing. I'm
Don't
digressing.
drop the
It's
soap.
for men. It's for men. Yeah.
And the ladies
So-
get your girls checked. at a
Mam-
certain
mammograms.
time. These are your girls.
You can check them on your own.
Yeah,
You learn that.
yeah.
No, the doctors.
It's called a mammogram.
Yeah, mammogram.
This is the definition of delusion. This is what you was talking about.
But y'all gotta take it serious. You can't be joking
Because I
about it.
actually have a lot of stuff that I want to go through.
All right, go ahead.
But that's how you can check on yourself.
So those are the things that falls outside of our control, right? Genetically, there's a lot of things that we're exposed to that it just falls outside of our control. And like I said, the only thing that's going to be the best fighting chance against those things is going to be early detection and early intervention, okay? But there are things that fall within our control. And those are going to be health risk factors such as diet, right? Exercise.
Get your water in your
Where is
Denisha.
yeah.
That's what I was trying to
I was like, not to say anything, but I'm saying the information is important, and I want to make sure it reaches the.
I was wondering
right
if she
people.
got a
I don't
mail.
know where she went. Yeah, well, everybody. I'm not sure. Okay. Well, like I said, there's health risk factors that we can control. That's gonna be diet. That's gonna be exercise. That's gonna be physical activity, right? Like how much you move around, how active and engaged you are. That's gonna be smoking, whether you guys like it or not. A lot of people in this family smoke, and that's another health risk factor that makes you more likely to have all these health conditions. Right?
Alcohol as
that
well.
I'm gonna talk about. Yeah. Huh?
Daddy said alcohol as well.
Alcohol is in there. Alcohol's later in my thing. I'll tell you the risk factors with alcohol.
I got you.
A
little wine won't hurt.
Okay, I just said smoking. I didn't say what.
Oh, okay. I thought we were saying that.
I just said.
But y'all could have just listen to her so you can understand what she's saying.
Listen, I didn't specifically say what. I said smoking in general. It's gonna get you high. It's gonna increase your chances of having health conditions further along in the process, and it's going to make you more likely to engage with these as well as obesity, right? Those are going to be the health risk factors. And if you are listening to the list and you're just like, man, I'm hitting a lot of these things, I don't want you to be discouraged, but I want you to feel like you are in control of the direction that your life and your health could take. I just want you to be aware of it, right? I'm not trying to sit here and dictate what each and every one of you do in this room. I just want you to have the information so you can make informed decisions, okay? Okay? So regarding blood pressure, I want you to, well, not just blood pressure in general, I want you to be aware that African American people, the leading cause of death is going to be heart-related issues, okay? That's the leading cause of African Americans in general is going to be heart-related issues, right? And then we have the highest rate of high blood pressure, okay? And so understanding that African Americans in general have higher rates of high blood pressure, and in the family, we have a high blood pressure as a health risk factor genetically. I want you guys to put that into perspective of how important that is to regulate. Right? It's important to regulate that and make sure those blood pressures fall within norms, right?
Like,
okay. And we're going to talk about the normal blood pressure. So a lot of people, I took you guys' blood pressure today, and everybody has their number in their head, whatever the blood pressure was that I took. And if I didn't take your blood pressure, I could still take it today. But your blood pressure should be in a healthy, young, healthy individual, your blood pressure would be between anywhere from 1 to 100 over 80. Okay? That's going to be the perfect blood pressure, right? Understanding that everybody's not perfect, right? Your blood pressure is going to fluctuate throughout the day. It's going to fluctuate throughout, like when you eat stuff, your blood pressure is going to change, but it shouldn't change dramatically, right? It'll be a little bit of different, but like I said, the normal is going to be within 100 to 120 over 80. That's going to be the normal. And I want to explain to you what the blood pressure is actually saying, right? Everybody has blood in their body, and we all have tunnels that the blood flows through. So those are they're called vessels, but they're like tunnels. Just imagine they're tunnels. And if the tunnels are constricted, your blood pressure is going to be high, because now your blood is under a lot of pressure. So the tunnel is very small and your blood pressure is high because it's trying to force itself through the tunnels. But when they dilate, when the vessels or the tunnels dilate, that's when it becomes normal. Like your blood pressure should become normal. But when your blood pressure is constantly high, there's a health risk that you're exposing yourself to. And I want to discuss what that is after I talk about the signs. So when your blood pressure is high consistently over a long period of time, you could experience, right, like headaches, severe headaches. You could get heart palpitations. You could also experience nosebleeds. And what is happening is your blood is rushing through those tunnels very, very fast. So you could have a nosebleed. I've seen people have bleeding in their eye. And I don't want to scare you guys. Like I said, I want to just give you the information. No. And what happens is your blood pressure has to be high over a period of time. This is what would happen. And obviously that's not the worst case scenario, but it's a sign that your blood pressure is high. As well as I've seen bleeding out of the ear, okay? And the reason why that happens is because your aorta is where the blood goes to. And I don't want to get too deep into it, but like I said, nosebleeds, maybe bleeding out your eyes, bleeding out your ears, but heart palpitations. But it's important to just check your blood pressure regularly. Keep up with your primary care doctor. I will talk about preventative measures. Don't worry. And so if your blood pressure is not addressed, I already talked about that. But just like your blood pressure could be too high, your blood pressure could be too low, right? If your blood pressure is too low, you could experience dizziness. You could pass out. There's a lot of things that can happen if your blood pressure is too low. And like I said, the normal is within 100 to 120 over 80. If it falls below 100, usually if it's like 90, you'll have symptoms. But if it's 90 over 80, 70 or something like that, you could pass out. And usually that is from dehydration. You can have an internal bleed, you can have an exterior bleed, right? No, it's okay. You could bleed out, right? Like if you have, and like I said, this is a lot of blood volume loss. But like, this is from excessive blood loss and dehydration, why your blood pressure would be low, okay? So like I said, and I'm sorry I skipped the part, when your blood pressure is high, I don't mean that like, oh, if it's 140 over 80, it's gonna be ridiculous. I've seen people with blood pressures 200 over 80. So I don't want you guys to get alarmed or think that like, oh my God, it's 140, I'm gonna like, no, there's definitely corrective measures that you could take before then. But like I said, I just want you guys to have the information. The symptoms that I talked about with high blood pressure, like I said, that's normally when people are like 190 over 100, like literally the blood pressure is like really in the 200s, okay? So like I said about your blood pressure being too low, but there's good news. There is good news. There are ways that you can help lower and regulate your blood pressure based on diet and physical activity. A part of the things that you could do to help regulate and decrease your blood pressure is going to be increasing your intake for leafy greens, right? Like leafy greens, meaning like salad, spinach, all the stuff that's like green, like the spinach and stuff like that. Green kale. What is it?
Broccoli, asparagus.
Collard
greens is going to be another thing. Another thing is going to be beet juice. So I know that we really tried with the beet juice. The juicer just drew. Okay. Yeah. I'm so glad that the people who got it was able to experience it. But beet juice is going to be really awesome in decreasing and regulating your blood pressure. With the beet juice, you have to be consistent. You just can't have 1 cup of beet juice and you think that, oh my God, my blood pressure is going to be 120 over 80. You know what I mean? Like consistency is going to be the key with a lot of these things. It's going to require life-altering decisions when you're deciding to increase the quality of life that you have, right? So then, so we discuss leafy greens as a possible solution for regulating and decreasing blood pressure, as well as beet juice, but also garlic. Ginger's not on here, but garlic and sweet potatoes, garlic, beet juice, and leafy greens, okay?
And
as well as...
You should mention the seasonings you put on them should probably align with what you're trying to do. Don't be throwing a whole bunch of salt on you.
Salt, that's gonna be something else.
I know, but I'm just saying be conscious of
just be mindful.
The way you season
Put some jalapenos.
So what though? Season what?
Like if you want to have a potato, what are you gonna?
Sweet potatoes?
Yeah, like a sweet potato, or how you gonna cook your broccoli?
Sweet potatoes.
Put some honey on there.
Put no salt and pepper on those.
I know. I'm not thinking that.
Y'all acting slow. She was basically saying.
All right, y'all get sidetracked. Go
I mean, I think that was an important mention.
So yes, leafy greens, beet juice, garlic, sweet potatoes, but also eating fruits and vegetables that's high in potassium and nitrate. And potassium and nitrate are both gonna help with relaxing the blood vessels. So remember the tunnels that I told you your blood travels through? It's gonna relax. It's gonna help relax them. So if your blood vessels are constricted and they're like stuck there for whatever reason, it's gonna help dilate those blood vessels. Okay. Okay, cool. We all on the same accord about that. As well as being physically active, right? Like we talked about that before. Physical activity, reducing your stress, quitting smoking if you do smoke, losing weight, and then this is where alcohol does come into play, right? Alcohol does. Can you relax? Alcohol does it does impact your blood pressure, but it's and you definitely don't want to chronically drink. You don't want to binge drink. That's going to be really bad for your blood pressure. But what happens? Yeah, what happens when you drink is that when you drink alcohol, it constricts your blood vessels, so it does increase your blood pressure. But once the alcohol works through the system, that's when your vessels dilate again. So that's what I said. I will mention it when it's mentioned, but I will explain what is happening. You know, when you drink, you're like, oh, I feel warm. I feel, like I don't need a jacket. I'm hot. That's where that comes in. Because it does give you like your blood vessels do constrict, okay? So we talked, everybody got that? Do I need to go over it again? No. All the tools for you to regulate and decrease your blood pressure. Okay, we're gonna move on. Now when your blood pressure is high, consistently, I do have to make you guys aware of how severe things could get, right? If you decide not to correct your blood pressure and it remains high consistently, you are exposing yourself to health risk factors, right? And one of them is going to be strokes. I know that strokes are more likely to happen between people in the ages of like 40 to it's usually older people, but I have heard of rare case scenarios where people have had strokes in their 20s. I've actually went to medic school with a girl, she was 20 years old and had a stroke. And it went undetected because they didn't think that like a 20-year-old would be having a stroke, but she was, and she did have a stroke. But let me explain what a stroke, what it looks like first, and then I'll explain. No, first I'll explain what is happening. So what a stroke is like, you either have some bleeding in your brain because one of the blood vessels in your brain bursts from being under so much high pressure, right? When your blood pressure is high over an extended amount of time, your vessels, the walls, they thin. And then one of the blood vessels in your brain, it could burst and you can have a head bleed, right? Or you can have a clot that dislodges from your heart. And like I said, the first place to get blood is your brain. That's where the blood goes. So usually like when something goes wrong, your brain is the first to know. And with a stroke, that's one of the things that could happen. You either get a brain clot or a brain bleed. And how it presents itself is you will have you'll be talking normally, and then you could suddenly be confused, you could be altered, you could be dizzy, you could start slurring your speech, you'll have weakness on one side, or general weakness in general. And I think this is important even for the younger people to know, because if this happens and you're around somebody who's having a stroke, the best fighting chance that they have is to be at a facility that deals with strokes. So you have to know. Right, so that's what I was going to say. So I discussed, it will be sudden confusion, altered mental status. You'll have facial droop to one side, weakness, and probably difficulty walking, right? Depending on what they're doing. You'll notice my loved one is acting funny, I don't know what's happening. And you have to just understand that there's symptoms of a stroke and then know to call 911, because that's going to be the best thing that you could do in that scenario, okay? So
and you could also mention aneurysm in the stroke.
We have aneurysms also in the family? Who had an aneurysm? Who?
Oh, well, yeah,
Big
the
son?
kids. Yeah, he did.
He had an aneurysm? It's basically like a bleed. Oh, so see, this is why we have these conversations, because I think it's important. I think that the reason why I only knew about a lot of the health medical conditions I run in the family is because I asked. I literally I'm like, Grandma, what, and a lot of people didn't know the stuff that Grandma had to overcome and battle and fight, because it's not something that she talked about, which is not her fault at all, but nobody talks about their health. Nobody talks about their health. Yeah, nobody in this family openly talks about their health conditions or whatever is going on with them. And I think that it's important for us to discuss so that we're aware of it, so we know that. You talk about it?
Yeah, I come to you all the time.
All right. Okay.
Yes, exactly. lately.
That was like last month.
Like I said, well, you guys know y'all can come to me for anything, but I did just want everybody to have a general knowledge about certain things, right? So that, you know, these are things that we're just all aware of and we can just kind of, you know, go accordingly. But I didn't know aneurysms was something that Big Tony had, and also he had a stroke.
Yeah.
And so the thing about stroke, and I'm so glad that we're talking about it, is the longer you go with having a stroke undetected, you will have permanent damage, like irreversible damage. Yeah. And so I'm guessing in Big Tony's case, he was able to get to a facility
he got
quick enough.
The thing is to react fast.
Yes.
And the faster you get medical
attention and treatment.
Yeah.
Because strokes is nothing that we could do before. Like, literally what I would do if I get on scene, I recognize somebody's having a stroke, and I'm going to just use Auntie May for example.
You ain't.
I'm just saying because she's right here.
No,
but there's a stroke assessment we do. I'll show you the stroke assessment we do, right? So if I come up to Mr. Neza Porter and he's acting funny, I would ask a loved one, hey, is this normally how he acts? They're like, no, this is not how he normally acts. I'm like, hey, Neza, do you think you could squeeze both my hands, right? I'm trying to establish equal, like,
strength.
Yes, equal strength on both hemispheres of his brain because, like I said, when you're having a stroke, there's a bleed or a clot somewhere in your brain. If it's happening, it's going to affect one entire side of your body. And depending on how long that goes, detected or undetected or whatever, it will affect his grips, right? And then the longer it goes, it will affect a lot more stuff. You'll see more dramatic differences between the two. So I asked him if he could squeeze his hands. If I notice a grip, that's going to be a note in my head that, okay, this is possibly a stroke, right? And then I'll be like, hey, Neza, can you smile for me? Like smile, right? And I want to be able to see his teeth. And like I said, when you're having a stroke, it's affecting some part of your brain. And when you smile, it's going to affect your smile, whether you're trying or not. It's going to affect your ability to contain muscle strength in both of your facial muscles. So like if he's able to smile perfectly, that's fine. I'm like, okay, because all this is telling me how severe the stroke is, right?
So Shamar had a stroke?
Who?
Shamar.
Who's that?
From TikTok.
That's
on the
That's not funny because he really does have it. No, he was born like that. His body.
I was about to say his torso is
fine. Yeah.
Doesn't he
have scoliosis? Yeah. Does he have
I was about to
scoliosis?
say, I think that
Probably,
might be
yes.
yeah.
Well, she said affect one side of the body, so I don't know.
She's
So,
also
you
acted
gonna
this
do the
normally
dance?
how he is.
You're the one that make the TikTok.
I'll make the TikTok shit.
He got a big.
How did this go from health to TikTok?
You can do that.
Because they're making a joke out of it.
No, we're not.
You are though.
Because you know.
You made multiple.
So basically, when I get on scene, I'm just gonna be establishing how if I basically identify if a person is having a stroke or not, right? I'm not a doctor, but I'm telling you guys as a medical provider, as a paramedic, what I do, right? I'll get a line in him because as soon as he gets to the hospital, and like I said, the most important thing is going to make sure that he gets to a stroke a facility that is capable of handling strokes. And normally we take them to Tufts, right? Tufts Medical Center is going to be the best place to take stroke patients, but we will take
No.
We take them to stroke. We take them to Tufts, and I would get a line in him because they're gonna want to give him medication as soon as they're gonna do a CT scan of his head, see if he has a brain bleed and if he has a clot. And like I said, we'll get a line in him, and then they'll be able to give him thrombolytics, which is a clot buster. If he does have a clot in there. If he doesn't have one, then they'll have a different approach. But basically, like I said, if a loved one is around, and for you little ones, it's going to be important for you to know because, like I said, sometimes somebody might be having a health emergency and they can't get help themselves. Mm-hmm. So you guys are going to have to be able to recognize, hey, what's going on? Because a lot of the times, right, we're not fortunate to have people around. And I'm going to discuss another health emergency that happened to somebody in the family. And it's like unfortunate if nobody is around to recognize or even help. It just unfortunately, you know what I mean? Like your best chance is going to be to call 911 and say, hey, I think someone is having a stroke, right? And then just, yeah. But if I say the symptoms, of what, and then you're like, oh, mommy, why are you leaning to the side? Or mommy, why are you whatever? Are you okay? And they're not making any sense. Yeah. Call 911 and say, hey, I think my mom's having a stroke, or I think my aunt, whatever. Because now the paramedics who are responding, they know, all right, now I think I need to assess this person if they're having a stroke. If they're not, fine, right? If they're not having one, fine. You did your job. I'm sorry. I thought, something was wrong with her. Another thing could be, diabetes runs in the family. That's another thing that we would check is the blood sugar, right? So I said when I get on scene, I would check, do a fast ED, a stroke assessment scale on my patient. I would get a line, and then I would check a blood sugar, because sometimes, right, when you have very low blood sugar, it could present very similar as well. So that's the 911 is going to be the best thing to do when you suspect somebody of having a stroke. Okay? Now we went over strokes. Does anybody have any questions? Because I'm going to move on to something else.
No.
Okay. No, you don't need to clap, because we are going right into heart attacks. What? Oh, we almost done. Okay. I want to touch bases on everything. All right. So another thing, if your blood pressure goes, right, if you have high blood pressure for an extended amount of time, undetected, unregulated, you also expose yourself to heart attacks, right? And what happens is your heart is just unable to function appropriately or normally, right? And so what a heart attack presents itself is, right? Somebody might have like sudden chest pain. You could be sitting, you don't even have to be doing anything. You'll be sitting, minding your business, resting, watching TV. It presents itself as chest pain, right? You can have chest pain, you can have pressure, you can have tightness. And I'm saying this because you will be surprised. Well, first of all, we have a cousin that died from a heart attack. Didn't Pamela die from a heart attack?
That was during COVID.
No, it doesn't matter. It's a heart attack, and nobody was around. Yeah. And so
she was at work.
They let her. She was having pain.
She was unconscious. Yeah.
There was people around, but they just didn't assist
No. What are you talking about? No one seen her.
Yes, sir. There was 3 other employees there.
Nobody seen her. They found her.
They sent her and they let her go into the
break room by herself. And so, like I said, for a heart attack, if someone is having a heart attack, how it presents itself is going to be like sudden chest pain, right? Discomfort, whether that's pressure, tightness, it could just feel like just a pain, or you just feel weird, right? It could be left-sided numbness or pain, right, on your left side. It could be jaw pain, like any pain in your jaw. Yeah.
Is it specifically the left side?
Yeah. Typically, right? But I'm going to explain there's some differences with women, because women don't present the same. Sometimes women could be having heart attacks and not even have any of those symptoms. So it's hard because women are kind of like asymptomatic. We don't even really like often show some symptoms. So, but it presents differently for women sometimes. So you can have chest pain, pressure, left arm pain, pain in your jaw. And then with women, like I said, it's difficult to detect or to we don't show the same exact way. Women and diabetics as well too. But sometimes it comes on like nausea. You could feel fatigue, just feel really weak all over, like general weakness. And another thing is like difficulty breathing. So you might just have like you're like, it's hard for me to breathe. And
anxious.
Anxiety,
yeah.
It could be anxiety. That could be it. Yeah. But I don't want you to underestimate any of the symptoms, right? Because understanding that high blood pressure runs in the family, it sounds like cardiac, we have some cardiac history as well. Yeah, and I think that it's important for everybody to take their body seriously, right? If you feel like, oh, dang, like, oh, I feel like this pain in my, it's okay to call 911 because they will do a 12 lead. They'll literally like hook you up to a monitor, take a picture of your heart. Yeah, EKG, take a picture of your heart. Best case scenario, they're like, there's nothing, we don't see anything. We should take you to the hospital because there's a blood work that they could do at the hospital to detect if you are having a heart attack. But when paramedics get on scene, we could do a quick 12 lead and we could be like, hey, I don't see anything abnormal. I do recommend that you get it checked out, and then you could decide from there or not whether you do what.
Do we still have to pay that $1,000?
No, no, but that's a good question because I feel like a lot of people, when I get on scene, a lot of people be like, oh, I didn't want to call because I didn't want the bill. I'm being serious. It's something, it's very...
They don't have to pay when they just get checked out.
When you get checked out, for us to come out, there's no bill.
But
when we transport, but also I don't want that to deter you because the paramedics will tell you in your best interest, hey, I think, honestly, if you're having a medical emergency, they're not going to allow you to deny. They're going to say, I'm sorry, I don't care, we have to take you. Like, we see a lot happening on this. You have to go. You do have, in certain situations, you do have the right to decline, right? If nothing is going on and you're just like, hey, I just got scared and whatever, they would recommend you, but you don't have to go. But if you're having a true medical emergency, we fully act within your best interest. But you do have to recommend that, like, paramedics are human, and not every paramedic is... No, not every paramedic. Like some people, you know, like any job, people are tired. They're just very dismissive. They'll just be like, "Oh, you don't really gotta go." You know what I mean? And it's just like
I won't make
at the
it
end of the
right
day,
away,
you have
no.
to have your best, be your best advocate.
If I make it over the next hour or so.
We are trained and licensed to do our job in your best interest, but also have your best interest at heart as well. Okay.
I have a question.
Yeah.
So for a heart attack and also for a stroke, is it possible to survive if you don't detect it? Like, is there, like, if you had a heart attack, you didn't know you had a heart attack?
I'm gonna tell you, for a stroke, there are yes, you can survive with a blood clot. Only the blood clot. If it finds its way dislodging. And going further into the body, then the stroke will resolve itself. And you can, and they call that a TIA.
If it's a brain bleed, you wouldn't.
Yeah, if it's a brain bleed, they have to stop. Yeah, they have to stop the bleeding, or else you're just gonna keep bleeding in the brain. What are you talking about?
It is true. You can heal from it, but.
Yeah, you can heal from it, but she's saying if it goes unaddressed, like you don't get medical help
like
for
you
it.
didn't know about it.
What are you gonna say, Auntie Janima? What information you have to the team?
She was just talking about my dad, the way he healed up after, because he had like the cane. He was like, very
you can heal.
No,
but she was trying to say
he went undetected for a week after he had that stroke.
It was a brain bleed, though.
Yes. He had when his primary doctors.
But he eventually got
a week later.
No, but Auntie Geneva, I also don't know how much and how severe the bleeding was. Right? It could be a slow bleed. It could be fast. I'm just telling you, though, it's a health emergency. There's no way that I'm gonna recognize that you're having a stroke and be like, oh, you're good. You can. You know, you can go to me as a healthcare provider. I'm not gonna let a stroke patient just stroke it out. And be like, oh, I'm not gonna be like, you'll be better tomorrow. Right? That's. I don't think that's accurate information to even give people to have. Like, I'm not saying that there's not case scenarios.
Basically, she's saying that was a miracle.
It's a medical situation. And again, I don't even know what type of stroke and how severe.
The second.
Oh my gosh. It's okay. Continue on.
What about the heart attack?
With a heart attack, no, because I'm gonna explain what can happen with a heart attack that goes undetected. So, for a heart attack, I'm so sorry. Like I said, chest pain, pressure, left-sided numbness or pain, jaw pain. For women, nausea, fatigue, could be feeling like anxiety. These are gonna be things that could present itself as a heart attack, right? With somebody who is having a heart attack, right? you definitely want to call 911. It's definitely a health emergency.
Baby
that
aspirin.
needs, huh?
Baby aspirin.
Yes, baby aspirin. I was
Wait,
gonna get into
quick
that.
question for Mariah, Vania, and Jahari. Y'all at home with an adult. You see them acting funny. What do you do? What? And say what?
I think my parents is acting
No, that's not what you said. She said, I think my parents is acting funny.
No, they need to know that part.
First, I ask if they're okay.
Yeah,
and
you
if they
should.
don't
Okay.
respond, then I call the cops.
And say,
No.
My parents are acting funny.
You say.
Don't say acting funny.
You think I-
Don't say acting funny. Just
Just
say
say-
they're not
yeah.
responsive.
Say exhibiting.
Or like a medical
Talk about
emergency.
some big
But the only reason we say don't say acting funny because
acting funny.
You don't
saying
want to
acting
delay.
funny can mean a lot of different things.
Yeah, they're gonna be like,
They might send the best team. Like, you don't
No,
know.
but she said specifically to say call 911
And say we're having a stroke or a heart attack, and they're figuring out.
All you say is, I think someone's experiencing health complications.
no,
I know. I think afterwards they need to get
to
That is true. There's a lot of information. And I do understand that, but like I said, I wanted you guys to have the tools. So anyways, when somebody's having a heart attack, right? Whether it's you or somebody you're around, you recognize like, hey, what's going on? Like, oh, I'm just having some pressure. I'm having pain. I'm having like pain in my arm. It's okay. Or you see them gripping to their left, like, oh, they might be like this. I'm not gonna lie. I've even seen people have heart attacks where they're just like, I feel funny, right? And they're fine, but they just feel funny. They feel off. But anyways, yeah, the thing that you need to do, make sure you call 911. Say, hey, I think somebody's having a heart attack. Like, I think, and like I said, we'll come out, do a 12 lead if they are, and confirm if they are or not. Baby aspirin, okay? 4 tablets of baby aspirin. That's gonna be.
What if you don't have baby aspirin?
Get a defibrillator.
No, not that serious.
But listen, if you don't have it,
is
it's
baby
okay.
aspirin literally for babies?
No, for adults too.
No, I mean like
chewable baby aspirin.
You go to the
That's what we're gonna
pharmacy
give you.
and they call it baby aspirin.
Yeah, it says baby aspirin.
The like little orange tablets.
No, what I'm saying is like it's the one you give to babies, or is it mini?
No,
aspirin?
they're just mini aspirin. Like yeah,
okay.
they're chewable. You can give
Everybody
babies.
should have some in
Yeah, they're they're tablets, but you chew them. They're baby aspirin.
Are they still orange like they used to be years and years ago?
Orange, yeah.
Orange, yeah.
Why do you need baby aspirin?
I'm gonna
Yes,
explain.
for emergency.
So when somebody is having a heart attack, what the baby aspirin does, it's not gonna prevent the clot because there's a clot somewhere in the heart that's that the heart part of the heart is not receiving blood. So that's what it is, ischemia. There's some part of the heart that's not receiving blood. We don't know what part of the heart it is, but what happens is the baby aspirin prevents further clotting. So it doesn't dislodge the clot. It doesn't like slip the clot away, but what is gonna happen is gonna prevent further clotting, okay? But if you don't have baby aspirin, don't worry. You call 911.
Other options.
Okay,
While
that's
you
the
wait,
best thing. If you're waiting, yeah. If you're waiting, you're just like, okay, let me just take the baby aspirin, or you just want to be like, let me just take this just in case. Baby aspirin, call 911, baby aspirin, and breathe. Yes. So if I get on scene, what I would do is I'm gonna immediately put stickers on your chest, right? I'm gonna be like, hey, I'm just gonna, whether you're a girl or guy, the stickers gotta go on your chest, right? Here and all on your left side. And then we take a picture of your heart. And then we can see if there's parts of your heart that's not receiving oxygen that's supposed to. And if we see anything abnormal, we'll let you know. Or we'll just start doing things. And we'll let you know, like, hey, I see something abnormal. We need you to chew this baby aspirin. They'll get you a line. And then maybe give you something for the pain, and then take you to the hospital, okay, for further testing. And they have to, in order for, when you're having a heart attack, they have to remove the clot. There's a procedure that they do. I forgot the name, don't sue me.
Y'all do that in the ambulance?
They do it at the hospital. So we would take you to a facility that has a cath lab.
What's the best facility to go to for heart attack?
Around here, Good Sam. We take everybody to Good Samaritan.
Good Samaritan.
I know, listen.
Wow.
I know. We have history in Good Sam, but listen, I have to say,
Stewart Healthcare runs that too, right?
Huh?
Stewart Healthcare runs that.
Yes, they do. They're the,
I've had several patients that have had heart attacks on my shift that and they were having heart attacks, and I take them to Good Sam, and what they do is a procedure while you're awake. They do it while you're awake. And I don't want you to Good Samaritan around here. In you guys' facility, in your proximity, it might be different, but take them to Good Sam. They do a procedure. They do it while you're awake, and they go ahead and put like they put a stent. But listen, it's like a tubing that goes through either here or here, and I seen it. It's pretty cool. Actually,
Oh, I know what you're talking about.
tube in your heart. They see what part of the heart is not receiving. They put a dye. They put a dye in your veins or whatever. They see what part of the heart's not receiving blood. They're like, okay, there it is. They put a stent in there, remove the clots. It's a balloon. And then they blow it up and remove the clot, and then restores the thing. And like I said, they do it while you're awake. They let you know. They
I've heard about
everything.
that.
I've seen it done.
I don't want to be awake for that.
They do keep you. It doesn't hurt. Yeah. So anyways, that's heart attacks, okay?
And wait, sorry, can you survive a heart attack if it's undetected?
I'm gonna explain.
Oh, okay. I'm like, you didn't answer
Heart
my
attacks.
question.
I know. I do want to explain
Like your
that
father.
heart attacks.
We will leave.
Oh,
All right.
You love the glitter.
I'm so sorry. I'm gonna wrap this up real quick. So, heart attacks. Okay. What?
Get them.
Oh. They got you in the peanut butter and jelly?
Yeah.
All right, so we already discussed heart attacks, right? If somebody is having a heart attack, what's the best thing that you're gonna do?
911 and baby aspirin.
And baby aspirin if you have it. 4
Or
tablets.
use an inhaler.
Sure, if you're having difficulty breathing, actually, don't do that.
Everybody got cancer.
No, that's not good to do. Mix it.
If you're having difficulty breathing and you're having a heart attack, it could be CHF. And there's certain things that you don't want to give to CHF patients because it could flash them. So you don't want to do that.
Now,
I would never advise.
now, if they're on Coumadin or warfarin, do you give them the aspirin too?
If they're on Coumadin and warfarin.
All warfarin.
Those are blood thinners?
Mm-hmm.
Technically, you don't need it if you.
Yeah, you can. Oh.
Grandma.
You already.
So yes.
It won't hurt.
So yes. So the baby aspirin is it's not a clot buster. It's not going to bust the clot. It's going to prevent further clotting. So yes, if they're on blood thinners, they're going to be bleeding regardless. It's not going to stop the bleeding. So yeah. Okay.
Very good.
Heart attacks, if they go undetected, it can lead to cardiac arrest. Not can, will. It will lead to cardiac arrest. Cardiac arrest is when your heart is unable to pump effectively and you're unresponsive, and it does lead to death if you do not get help. Okay? Huh? Well, you have to hear it because I'm gonna tell you. Sometimes you might see somebody unconscious, and you gotta know what to do. You gotta be like, you know what? My cousin told me. I know exactly what to do.
First thing is dial 911.
So it can lead to cardiac arrest. Cardiac arrest is when your heart is just unable to pump effectively. It either stops beating, your heart stops beating, or it stops beating effectively, and you are unconscious, right? Nobody can wake you up, nobody can get you, and you won't have a pulse. That's when time is essential. Time is very essential. You definitely don't want to wait until it gets to this point, but time is very essential. If you see somebody unconscious on the floor, you try to wake them up, they're not moving, maybe you could check for a pulse. Right, there's several places where you can check for a pulse. You can check here. You can check here. You won't get a pulse here.
How much time does somebody have?
So every, I think 3 to 5 minutes. I mean, your brain.
Really?
I'm gonna tell you. Well, not 3 to 5 minutes. I'm just gonna say how brain dead you'll be. But like, you definitely don't want to delay time. If somebody's unresponsive on the floor, that's your brain going without oxygen, and that's the biggest organ.
Oh, so you started CPR or something?
Right away.
Oh, okay.
I mean, you gotta kick them if you have to. Like, yo, you awake? You know what I'm saying?
They usually do the chest rub.
They do sternum rubs. Yeah. Definitely
with the
don't kick them.
knuckles.
I was just saying. I was saying make sure that the person is not responsive. But like you shake them, you can pinch them here. You can say, hey, wake up. If they're not moving, you check for a pulse, right? Immediately have somebody call 911. I mean, I don't care what the case is happening. If you see somebody on the floor, call 911, right? They don't have a pulse. You want to immediately start compressions. I know a lot of you guys, some of you are young. Yeah. Right between.
But
right
you have to
between-
press really hard.
Yeah.
Because you gotta break the ribs.
And so let me explain.
It's
So
like an inch and a
getting
quarter. You have to press
911
down.
Getting 911 en route is essential. You do want them because there's only so much compression that you could do. Early compressions is huge. Let me tell you, because there are people who have survived cardiac arrest, and it's because early compressions, right? Make sure you call 911, and if you can, do compressions right away. Don't just sit there.
CPR certified.
Anybody CPR?
I got my OSHA license.
He got his OSHA
I
license.
got my OSHA license.
He's got his OSHA license.
Wait, Zion, you are for real?
Yeah, the community service.
Navon's he's a lifeguard, right?
Yeah, Navon had to.
Navon's got his CPR certification. Well, they got rid of all they only do compressions now. There's no air.
Don't have to do a breath. So I'm gonna tell you right now, the breaths are not. There's no science that proves that the breaths make a dramatic impact on people's survivability. Yeah, definitely don't put your lips on nobody. It's gonna be compressions. You're gonna be tired. You probably got 2 minutes in you before you're exhausted, and that's if you're doing it right. What's up?
Okay, I'll just say after you're done. But it has to do with,
there are mouth guards if you
don't even worry.
The,
I'm gonna tell you right now. The breaths are not essential. Yeah. The essential part, whether people make it or not, is being very immediate with your response and then compressions. What's up?
I'm like, what if you can't find a phone?
A phone?
Like to call
Yo, help.
Yo.
And then also you could like just run real quick and be like, help, anybody, someone call 911. Or like find a phone real quick and bring the phone to you, call 911 and say, I need help, and then run to them. Because like I said, the longer you go without, they could have some like, their brain, it really depends on how long it takes them to get the medical help and treatment that they need. What's up?
If like you check for a pulse, how do you know that there's a pulse?
You'll feel it.
You'll feel it.
You check
here.
Fingers.
You can check here.
But with your thumb.
You probably got to show.
No, don't use your.
Yeah, do a demonstration.
Use your 2 fingers.
So feel it on somebody. You can check somebody. Well, the wrist they're not gonna have. Your blood pressure.
Always by the neck.
Yeah, you can have a blood pressure like 90 over whatever. Like if it's over 80, you'll feel it here.
It's
if
right
it's less than
below
80,
the lower
you can feel it
jawbone.
here. So,
what if like you're doing CPR and like you get tired?
I know. And that's the thing. And you have to make a decision, right? Do I want to stop doing compressions and risk this person not making it because I'm tired? Or do I really want to keep going? And I'm telling you, you could be the healthiest person. Even us healthcare providers, we only have 2 minutes on the chest. It's like impossible for you to go 10 minutes. That's why I say it's important for you to call 911 because you want help to be on the way. You don't want to, you're not going to just revive this person by doing compressions. What you're doing is just allowing the blood to go to their brain, right? Because the blood stopped pumping. It stopped pumping for whatever reason.
So you're pumping their heart.
And you're pumping it for them. And so if you take a minute, the longer you go without doing that for them, they're not getting oxygen to the brain. Just think about that. So like if you're tired, you could be like, oh my God, I'm tired. But like try, you know, it depends on how important this person is to you. Because if this is somebody I love, I am going to be doing some type of compressions until the paramedics get there. And then you could tell them like, I tried. And they'll tell you what to do after that. They'll say, thank you, move to the side, and they'll take it from there, you know. But that's why I say you want to make sure you call 911 and make sure that they are on the way. Any other questions?
Okay, so this is a question.
That's it for
but
cardiac arrest.
I was in the mall working. This is about like 3 weeks ago. So I was in the mall and someone had a seizure. And my boy has a brand called Quenda. So So me and him and myself stepped into action. He just called, and I was making sure like he wasn't having like biting his tongue or anything, making sure that everything was okay. And then it took the ambulance 13 minutes to arrive.
So it does take time, and that's why I said 911. You gotta call them right away. Anything is happening, 911. You can still do interventions. What's up?
What if like they like keep asking questions?
Keep
The
answering.
911?
Yeah.
Put on speaker. Put on speaker and be like, I'm doing compressions. I don't know this person, or this is my loved one. I don't know.
Whoever's doing the compression should be on the phone.
No, you could be on the phone.
phone.
You could be on the phone doing compressions. I've done it before.
And when you're doing compressions, ribs are gonna crack. There's gonna be some nasty stuff that happens. But that just means you're doing it effectively. If nobody else has any questions on cardiac arrest, we're gonna move on.
Okay, let's move on.
Is it gonna crack?
What?
Well, you will crack a rib, yeah. It's gonna sound like almost like a plyboard, like you're pushing a piece of wood up and down.
Oh, the ribs crack.
You're not doing it right. If you do not feel comfortable doing it,
You'll feel it, yeah. You feel the pressure.
If someone is unconscious, you better do some type of CPR. Don't just be sitting there like, I don't know.
How do you do CPR?
I don't know.
Some people really not meant to.
Yo!
right. No, but
I get it.
that people, I didn't know what I was doing. I thought I was helping.
But you can also, the 911 person could.
Under the Good Samaritan law, they can't sue you.
It's a Good Samaritan Act. It's a
Yeah.
Good Samaritan law.
That's been up for years.
You can sue people for anything. But there's a Good Samaritan law that protects you. What's up?
But notice you put your hands on somebody, you gotta stay there until.
Now, if it says do not resuscitate, don't resuscitate. If you see a wrist that says do not resuscitate,
No, Daddy, nobody has a bracelet. There's a paper, there's a document.
some people do. The older people do.
Allergy bracelets, but there's no do not resuscitate bracelet. That's a legal document that has to be signed by the person and the primary.
But now, how do they identify it in the field if somebody's in
We
the
have to
field?
have a physical document.
As have a
Or
document?
we're doing all life-saving skills.
Because I heard
We
of
have to have the document.
I heard of people having necklaces on their neck that say do. So there's no such thing.
You can't put it on your neck. You can't put it on your wrist. Those are not legal documents.
Those are legal
It
documents.
has to be a legal, and people who have it know, but it's a DNR.
I got you.
Literally, a DNR form
Mhm.
is filled out and signed on the back by the person
Mhm.
and the doctor.
Okay.
And it will tell you to what extent the DNR is. Maybe do not intubate, do not do compressions.
Okay.
Do not. It literally says that. Other than that, we're doing everything.
Gotcha.
I don't care if you got a bracelet. You can have a bracelet that says "Do not save me," and we don't care. You can have a loved one that says
That's serious.
"No,
That's
they
good to
have a
know.
DNR," but if we don't have it,
Mhm.
we are doing everything.
Right.
That's just how it goes. But anyways.
Until you had a question though.
Yes, Auntie
I
Alicia.
totally forgot what it was.
That's good to know though. I like that. It's interesting.
I just want to be able to educate you guys because, like I said, there's things that I know. I'm almost done. I'm not done. I know you guys are getting ready. So diabetic emergencies. That's the other thing that I want to talk about because diabetes do run in the family.
I see.
Okay.
Let me start.
Type get that crumble now.
Type 1 diabetes is the one that you're born with. You live with it for the rest of your life. That's the diabetes that does not run in the family. The one that runs in the family is going to be type 2 diabetes, which is the one that is based off of your diet, exercise, and your health, just your habits.
Gotcha.
Right? And so signs.
Thank you.
So signs of
Yeah,
diabetes
just stick it on the side of the stick.
can be excessive thirst, excessive
Yep,
hunger,
yep.
fatigue, frequent urination, excessive weight loss or gain, blurred vision. That's just to name a few, right? And if you're experiencing any of these things, it's important to make your healthcare provider aware of it so that you can be like, hey, can I get checked? You know, like if they know that diabetes runs in the family and you just say like, hey, I'm just experiencing like increased thirst, urination, hunger. I just had extreme weight loss or gain. I just need, you know, like they'll know what to do. They do a blood test and they'll test you to see if you're diabetic, okay? And what is happening when you are having a diabetic emergency? Well, diabetes in general, your body is unable to regulate blood sugar, right? And your blood sugar, the normal levels is going to be within. You need to be paying attention on Larry and not chomping down Doritos. All right?
I think he's waiting for your Starburst.
It's not Starburst.
I know the needles are on parts.
It's a little hit on your prick.
Needle.
And I don't know why you don't want to do it. Can y'all relax? Nobody has to.
I know
get
all
it
them
if they don't
copies
want
you
to.
be throwing.
Mine is gonna be perfect again.
What's in here, Crump?
I'll let somebody do mine, and I don't even like needles. But your normal. What? And your finger. Oh, for your diabetes? I didn't even know they had that for the arms. So, also.
Are they allowed downstairs? They just.
Who's them? No, tell them to come up, please.
How important is it to drink water? It's important to drink water, right?
Water, you guys.
6 glasses a day.
Alright, so I'm almost done. Like I said, with the blood sugar, a normal blood sugar is going to be within 70 to 100, right? That's just a perfect case scenario. Anything lower than 70, your blood pressure will be too low. And that's called hypoglycemic, right? You could be hypoglycemic. And what could happen if your blood sugar is too low, you can have seizures, you can, alter mental status, right? You could pass out. There's a lot of things that can happen with your blood sugar being too low, right?
Yeah.
With your blood sugar being too low, it's not the end of the world. You just need sugar, right?
Frosting.
You need sugar. The thing that's going to happen when your blood sugar is too low, and if you're unresponsive or unable, it's going to be the airway, because you could, if you're throwing up, you could aspirate and then choke on your vomit. Or if you're having a seizure, same exact thing. Not get the oxygen that your body needs. So those that becomes secondary to there's secondary things that could kill you in that event. But if your blood sugar is too low, you just want to make sure you get some sugar, right? You can have a sandwich, you can have orange juice, depending on your mental status, if you're able to eat anything or drink anything. What I would do as a healthcare provider, what's up?
Well, Denisha's back.
As a healthcare provider, if you are having hypoglycemic emergency, I would basically give you glucagon, or I'll give you dextrose. And glucagon is like it's a shot. Okay, I give you a shot in your butt. Depending on if you can follow commands, I'll give you oral glucose. You can swallow it, and you'll restore to your normal. Your mental status.
Is that sweet syrup?
It's
very sweet,
okay.
Very sugary.
The stuff they drink when you're pregnant to check your diabetes, like a Pepsi or orange.
I got you.
Well, gestational diabetes is gonna be something different, but we'll talk about that at another time. So what I would do is I'll give you oral glucose if you can follow commands, if you're not at risk of aspirating. If not, I give you a shot in the butt. I can give it to you in the arm. It's basically glucose. I would give you glucose, and I'll give it to you that with a IM, with a needle. Or I would give dextrose. Dextrose is another thing, and that's through the veins. So But either way.
Oh, I know what dextrose is. It's like a thing.
It's like sugar and water.
When I worked in the hospital, we had to bring that up to the nurses all the time.
Sugar water. Once
We had to learn that
that,
stuff in
when somebody's
the
having
hospital.
a diabetic emergency, they should be able to restore
Put them in the
to their
Baxter
normal
pumps.
state within minutes.
Yeah,
You know?
single Baxter
Like once you
pumps,
give
double
them
Baxter
sugar,
pumps.
they'll be like, oh, Auntie Alicia, you be feeling like that. She's like, oh,
I be hypoglycemic all the time. I'm like, don't talk to me. Wait a minute, I'm discombobulated. But if you acknowledge it is better because your body talks to you.
It's true.
So that's what happens when your blood sugar is too low. But when your blood sugar is too high, there are medical emergencies that you can encounter. And I get it that the normal is 70 to 100. But normally when people have hyperglycemic emergencies, it's when their blood sugar is like 400, 500, 600. Sometimes it goes higher, but people with diabetes know their normal limit because theirs won't be 70 to 100. Their body is not able to process and regulate sugars the way that normal people do, so they'll have a different normal. But with the symptoms that I'm about to explain to you is normally people who have experienced blood sugars 400, 500, 600 higher. Right? And what that is, you will I don't even have that listed, but you can have like headaches, migraines, you can feel hot, very thirsty, I think. Dizzy. You could just feel like not well. You just won't feel good. And I think somebody in the room probably knows what that feels like. Because it's a real emergency. Because if you don't get help for that, that does lead to further things. Like it is a life-threatening emergency. So
everybody's strong like me, so y'all got.
All right. And the thing with hyperglycemic emergencies, when your blood sugar is too low, it happens over the course of days. So remember where hypoglycemic emergencies, when your blood sugar is too low, that's instant. Literally, like you'll be fine, and then next thing you know, boom, like that is instant. It's instant. But when your blood sugar is too high, it happens over the course of days where you're just like, man, I've been having this weird feeling. I have a headache, or like I'm just like feeling really hot or dry, like my skin is really dry. Or there's other symptoms too. I'm sorry I didn't even list them, but yes. That's what happens when your blood sugar is too high. And like I said, that is a health emergency, so you want to make sure you call 911 or go to a hospital. There's no specific hospital, you just need to go to a hospital and they'll give you the care that you need. But you need to drink lots of fluids. Drink fluids, please. So then the good news is there are natural ways to regulate your blood sugar. Who would have thought it? There are natural ways to regulate your blood sugar, and one of the things is gonna be the cucumber juice that we had out there.
That was good.
Cucumber is
if you didn't get some, you should get some.
Yes, cucumber is a really great source for regulating and reducing your blood sugar. Okay, eating foods that's rich in fiber, that's also gonna help. That's whole grains, leafy greens, berries, and nuts. What it does is the fiber, it slows down the release of the sugar into the bloodstream. So it's also going to help with regulating your blood sugar. Okay? And like I said, the cucumber juice is out there.
Oh, that's what
and, yeah.
That's good. It's bomb, isn't it?
freshly juice today, too.
It got a little squig of lime in there, but it's good.
Wait, let me go get some.
Better try it. It's great.
It's really good for your blood sugar. I do have some.
You heard? Can you bring out one for Atisha?
I do have some strips here, as well as the glucometer here to check the blood sugars. That is the end of my presentation. I really do hope. You know what? I hope you learned something. I hope you learned something. Thank you.
You did real good.
If I would have had a PowerPoint, I would have put it all. It was on my phone. I would have had the PowerPoint. But if anybody wishes to get their blood sugar checked,
can I get my blood pressure?
There's a needle.
Tony, you say you don't know how to do the blood pressure? Or you just saying that? I just said that. So do it on the camera. Can do the other end.
I can show everybody. I can show everybody how
the reading and get tricky for me. Okay. I do the other machine.
Would you do the automatic one?
Yeah.
Everybody does the automatic one.
Oh yeah, you need it? You having a difficult time breathing?
Actually, wait, you about to do it now? You can show me
This is that's the original way how they do it.
I'm gonna check Zariah's blood sugar. I'm pretty sure it's gonna be normal.
Hey.
But I get alcohol swab, right? I'm going to go ahead and swab the area that I plan on pricking. I let that dry. While I let that dry, I'm gonna give you a
I did it one time.
Yeah,
That thing tight.
and this is so you know what it looks like. So
don't get on my sweater.
We can okay, check her blood sugar. This is what it's gonna look like, okay? Now, can everybody see?
What's all this?
You know how
Extra.
it goes.
This is
Okay,
extra. Somebody
area
else
has
needs it.
been sanitized and is now dry. I'm gonna take the lid off. Relax. Wait, look him, okay?
No, I don't like quick pictures.
Well, don't look.
So you want
This is the part I don't
That's
remember.
it. And she's done.
Look
She's
at that.
done.
She didn't even know.
Yeah, didn't even know. Look, I get one of these strips here. All right, relax. It's all right.
And that's right there in the part of the vein.
I get my glucometer. Let it.
And we wait.
And literally, it shows within seconds. 104.
Wow.
And what did I say the normal was?
One.
No,
Right this way. So
One,
It might come this
100
way
to,
eventually.
I mean 70 to
Why did that
100.
door pass fast?
She's very normal. And I didn't expect.
I think you got the valve open. No, the valve on it on the bulb itself. No, right here. See this? You gotta close that valve. There you go.
I'm gonna say because it's not getting tight.
So do we do our own sugar?
I can check sugars, or you guys can do your own if you want.
You can
It
check
doesn't
my
matter.
sugar.
I just wanted everybody to see how
Flip
it's
this
done, so
over. You're on the wrong side. That goes that way.
Oh, does
Just
it?
like that. Yeah.
Not me,
That's
not
okay.
It's easier if someone do
Here you
it.
go.
And then you're doing it yourself.
I know, right?
It's been a long time for me, but I know.
I want it super sweet.
So it could be any finger, but
Because I love that thing. I always go to the doctors and get it.
oh, yours is pretty.
Who got grandmother's Nike shoe?
Please, your sister.
165?
165.
You didn't get me.
We don't even care.
I don't know how to read it.
What does it say?
Oh, wait, it's not done yet.
Don't get me to start lying on that.
Michaela, come read this.
Michaela?
You gotta redo it again.
It's 160. You should try that.
Do it again.
Which one's
You gotta redo it.
No, just do it higher. Let me see, and then let it go. Go ahead. All right, that's it. Go ahead.
I'm
Go
gonna say
down.
this thing tight as a mother.
Go down. Release
Go
it.
down.
Release it. Release it.
Oh, that's the part I was missing.
I'm gonna say this thing
All right, now you're doing it so fast. I can't.
Well, you just said release
You know
it.
what?
Yes, release it.
You
right,
guys
let's give you a
gradually
break.
release it,
Yeah,
then
I'm gonna
kind
say
of
my
stop.
arm is.
See, takes a lot of practice though too.
But you're supposed to sit down. You gotta sit down. Sit down right there.
Relax.
And normally I would have gloves on. Look at that, 104. I didn't expect you to say anything out of the normal because you're very young, you're very healthy. You know what I
You can
mean?
watch it as well.
Yeah, it's good to just,
What you looking at?
huh?
Oops. What you looking at?
I should have had on gloves. Could I fill up my arm pump? Your what?
All right, everybody's. You get your blood pressure checked?
Wait, the blood pressure is the.
Yeah, that's the blood pressure.
I got that one.
You got that one?
I'm right
Sign
here.
fell on the floor and it came
Huh?
one of the things.
Oh, the shoes. Thank you.
I'm gonna learn all that tonight.
What happened?
I'm gonna learn how to do that tonight.
When the kid's about to do the one on the
Same thing.
Mhm.
Do you need help?
Got it?
You should.
You got it.
Let me bring up the eye so you. Can you hold it real quick so I can check my sugar?
Hold on, I'll get the one at the bathroom. Sorry.
All right, everybody got their blood pressure checked?
Yeah, just bring it out and boogie on down.
I can't even read it.
It's like 1:30.
Is that bad?
But
No, I didn't. Yeah, a little bit, but I don't know how to. This nozzle thing right here. That's what confusing.
Don't get my sugar shack. Ow! After she does this one. I'm getting my sugar shack.
Oh, I can think about the sugar shack. When you said that, all I heard was sugar shack. Oh my God. My brain is elsewhere.
This is why I don't do that.
So silly.
We about to all learn. She's giving her wrong numbers. She like told me I'm gonna leave you behind. I'll go.
I do that all the time.
Open the door.
Oh, they shut it.
No, they open. I know the door.
They need to
Quick
stop.
thing.
Really?
Mommy, this remind me when we have to do it for Grandma Lloyd.
Oh, yeah.
You haven't had your what?
No. Oh, my phone.
This is a big difference from yesterday.
That's pretty good.
L 103.
Oh, yours is good.
It does work.
See, 103 is good.
Thank you.
Let's see what mine is.
103.
You want to check yours?
You want me to come over?
Come over your
I know, I didn't know all about your I'm gonna take a guess. Mine is going to be 110.
But then the
Write it down.
110.
110.
Oh, I didn't even get a band-aid.
My part.
No, there's plenty of band-aid too.
No. Oh, you're just rude. You showing off?
Where's my mommy?
Like this is part of that cookie crumbles.
Not the cookie crumble.
I should. Yours and Ryan saying, that's not a cookie.
It's gonna be the
I know.
cookie
She
sugar.
would. I don't know. Are you done with your bath? Is she getting Cause she was taking it out. So I didn't want to disturb her. I didn't check.
You gonna check this sugar?
Which tray you want your sugar check?
116.
You made
You can't quite put a number.
I knew it was gonna be in there one something. That's
Is that bad?
No, we're not. No, it's not.
120.
Honestly, yeah. They say that the textbook norm,
That's what I don't really.
it's a
You
quick,
don't look.
yeah, it's a quick.
I want my blood pressure.
No, Shay, do Shay's sugar. Do your sugar. You won't feel it. We said Zariah even got it done.
I know.
Don't look the other way. You don't feel it.
Then afterwards you'll do my
Yo, did you just do mine?
pressure.
I'm gonna do mine again.
Did you do Daddy's?
I did Man's blood pressure. I mean blood sugar. His was.
Why you got the
I'm
baby
gonna do it. You
hour?
didn't do it today
For
though.
my, huh?
You do it today.
No, I know I didn't do it
I
today,
don't
but I'm just
like
saying.
this already.
It's good to
I
do
hate.
that.
I hate.
Do like I did. I looked the other way so I don't. Because you see it, you tend
No,
to.
Mariah.
So it's not
She
like.
said if you see you.
You do. Don't look.
I just feel like it's regardless. It's
No,
just gonna be.
you're fine.
I really just don't like needles at all.
No, I know. You're gonna be just fine.
Think of it as a prick, not a needle.
Yeah. Either way.
You won't even feel it.
Okay. Daddy, you know? Did you do it?
I had it done before.
Daddy, you said you had it done before?
Ooh.
Yeah.
See?
Okay. It
See
wasn't too
that?
bad.
I told you wouldn't. Because I don't like it either. But the diabetics have to really do this themselves. That's why I said I don't want to do it.
109.
What's that?
Winner, chicken dinner.
It's good.
This is good. Excellent. Mine isn't high. It's just all right. But I eat that cookie, so I would expect
That'll do it. That's sugar. I know. I got a cookie too that I will probably eat half. I really wanted to know if the crumble cookies were good or not because I hear that they're so bad. I didn't try
not that good.
Crumble cookies.
No, you're fine. I just want to make sure my sweater don't get hot.
No, it doesn't matter. This is really good that I can do it over clothes.
Yes, very overrated. And Sonia cookies are way better.
Which one?
Insomnia
Oh
cookies.
yeah, I
Way
like
better
it.
than
Yeah,
crumble
I like the insomnia cookies. Those
But
ones are really good.
sometimes it hits, like crumble cookies, sometimes it hits. Sometimes they had a honey bun cookie.
Mm-hmm. It was nasty.
Okay, straight up.
What is it?
125.
They'll be taking naps.
125 over 70. Is that good?
That's not too bad.
120 is the normal.
I gotta work out a little more.
5 motherfucking. Like I said, blood pressures fluctuate off of just everything. So yeah.
Not bad, not bad at all.
Still feel the praise.
You know you don't have to take your shirt off, right? I can do it with your shirt.
Alright guys, that concludes
The
the family education of medical.
I hope you guys learned something.
But Sheila's very knowledgeable about medical too. She's just being shy about it.
I don't know. Nikhil is definitely the professional here. Yeah, she's the professional.
But Sheila's pretty knowledgeable too. She don't have a master's for no reason at all.
Oh, LJ, perfect timing. You gotta go bring that box back to the car.
Alright guys, catch you guys in the next one.